Welcome to this masterclass on anemia in pregnancy, presented by Mr. Nagesh Sir of ND Nursing Coaching. Let's begin with a question on diagnostic criteria. According to WHO criteria, a pregnant woman is diagnosed with anemia if her hemoglobin level falls below which value? The correct answer is B, 11.0 grams per deciliter. The WHO defines anemia in pregnancy as an HB level below 11 grams per deciliter at any trimester. Although some guidelines use 10.5 grams per deciliter in the second trimester, 11 grams per deciliter is the universal cutoff for exams like NORCET. Next, let's look at physiological anemia. What primarily causes the occurrence of physiological anemia during pregnancy? The correct answer is C, a disproportionate increase in plasma volume versus RBC mass. Plasma volume increases by 40 to 50%. While RBC mass increases by only 20 to 30%, leading to a hemodilution effect. This is a normal adaptation for placental perfusion and hemorrhage protection. A pregnant patient at 28 weeks has an HB of 8.5 grams per deciliter. Based on WHO standards, how would the nurse classify this grade of anemia? The correct answer is B, moderate anemia. The WHO classifies anemia as mild at 10.0 to 10.9 grams per deciliter, moderate at 7.0 to 9.9 grams per deciliter, and severe below 7.0 grams per deciliter. Focusing on iron absorption, which of the following beverages should a nurse advise a pregnant woman to avoid while taking oral iron supplements? The correct answer is C, tea or coffee. Tannins in tea and polyphenols/caffeine in coffee inhibit iron absorption. Conversely, vitamin C found in orange or lemon juice promotes iron absorption. Under the Anemia Mukt Bharat AIIMS guidelines, what is the prophylactic dose of iron and folic acid IFA for a pregnant woman? The correct answer is B, 60 milligrams iron plus 500 mcg folic acid daily. The AIIMS protocol recommends this dose for 180 days, starting from the second trimester. Which laboratory investigation is considered the most sensitive indicator of early-stage iron deficiency in pregnancy? The correct answer is B, serum ferritin. Serum ferritin reflects total body iron stores and is the first value to decrease, long before hemoglobin levels drop. A peripheral blood smear of a patient with severe iron deficiency anemia, or IDA, typically shows which RBC morphologies? The correct answer is B, microcytic hypochromic. IDA causes smaller red blood cells that are pale due to low hemoglobin, which is the classic hallmark of nutritional iron deficiency. When considering parenteral iron therapy, what is a specific indication for using IV iron instead of oral iron in a pregnant woman with moderate anemia? The correct answer is C, non-compliance or intolerance to oral iron. Other indications include malabsorption, or the need for rapid replenishment in the late second or early third trimester. Iron sucrose is often the preferred agent. Before administering a full dose of iron dextran injection, which action must the nurse ensure is performed for patient safety? The correct answer is B, administer a test dose. Iron dextran carries a high risk of anaphylactic reactions, so a test dose is mandatory, followed by 30 to 60 minutes of monitoring. In a pregnant woman who is near term, such as 38 weeks, what is the primary indication for a packed red blood cell (PRBC) transfusion? The correct answer is B, HB less than 7.0 grams per deciliter. Severe anemia near term warrants a transfusion because standard iron therapy is too slow when delivery is imminent. Severe maternal anemia during pregnancy significantly increases the risk of which of the following fetal outcomes? The correct answer is A, intrauterine growth restriction, IUGR. Anemia leads to chronic placental hypoxia, causing IUGR, low birth weight, prematurity, and increased perinatal mortality. Folic acid supplementation, typically 400 to 500 mcg daily, is primarily recommended in the preconception period and first trimester to prevent which condition? The correct answer is D, neural tube defects. Adequate folate is crucial during the first 28 days of pregnancy, preventing conditions like spina bifida and anencephaly. Which condition in a pregnant woman is most likely to lead to megaloblastic anemia? The correct answer is B, untreated celiac disease. Megaloblastic anemia is characterized by large, immature red blood cells and is caused by deficiencies of B12 or folate. Celiac disease can impair their absorption. During the second stage of labor in a severely anemic woman, Why should the nurse be particularly vigilant for signs of congestive heart failure, CHF? The correct answer is A, acute autotransfusion of blood. The contraction of the uterus pushes a large amount of blood into systemic circulation. This volume overload can trigger acute heart failure in an already compromised anemic heart. Severe anemia in pregnancy is a significant predisposing factor for which life-threatening postpartum complication. The correct answer is D, postpartum hemorrhage, PPH. Anemia increases the risk of PPH due to uterine atony. Furthermore, an anemic woman has a lower physiological reserve to withstand blood loss. A patient presents with spoon-shaped brittle nails known as koilonychia. This is a specific sign of which condition? The correct answer is B, iron deficiency anemia. Koilonychia occurs in long-standing, severe iron deficiency. Other specific signs include angular stomatitis and glossitis. In endemic areas, which parasitic infection is a leading cause of severe pathological anemia in pregnant women? The correct answer is A, hookworm infestation. Hookworms cause chronic intestinal blood loss. Deworming with albendazole after the first trimester is recommended in endemic regions. Pregnant women with sickle cell disease are at an exceptionally high risk for which of the following complications? The correct answer is C, vaso-occlusive crisis. Pregnancy increases the frequency of crises due to the hypercoagulable state combined with sickled cells, leading to severe pain and organ damage. Which rapid screening test is commonly used in antenatal care clinics to identify carriers of beta thalassemia trait? The correct answer is D, NEST-ROFT, naked eye single tube red cell osmotic fragility test. A positive NEST-ROFT result indicates the need for definitive confirmation via hemoglobin electrophoresis. Finally, under the AIIMS guidelines, for how many days after delivery should a woman continue to take iron and folic acid supplements? Women should continue IFA for 180 days postpartum to replenish iron stores depleted during pregnancy and labor and to support lactation. Which of the following is the preferred intravenous route administration for iron sucrose to minimize reactions? Iron sucrose should be diluted in 0.9% normal saline and infused slowly, for instance, 200 milligrams in 200 milliliters over 30 minutes. Diluting in dextrose can cause drug instability. A pregnant woman on oral iron reports black-colored stools. What should be the nurse's response? Black stools are an expected and harmless side effect due to unabsorbed iron. Other common oral iron side effects include constipation, epigastric pain, and a metallic taste.